These are stills.
No. No, we're gonna start here shortly. My speech. I just want to take a capture of you guys as my audience. Thank you for coming to my speech for the class. I'm attending Luterno University, and I have a speech class at this time. Thank you, and we'll start shortly. Have you ever had or have a friend, relative, or boss that one moment he is the nicest human being in the world and a few hours later he is the most undesirable individual on the face of the earth? 1 minute happy and full of great ideas, the next minute he's depressed and ready to give up. If you answer yes, you have probably been dealing with a person suffering with a mental disease called bipolar disorder. I had friends that suffer from this disease. I watched them struggle with the disease. I attended some of their group therapy to provide them the much needed support. Due to my desire to help my friends, I have read a lot about the subject over the years. I would like to use my experience and research to generally describe bipolar disorders, symptoms, treatment, and contributing factors to you. Let us start with the symptoms. My introductory question leads into the problem of bipolar disorder. An individual suffering of bipolar has abnormal mood swings. What are abnormal mood swings, you might ask? It is mood swings not related to events that warrant a person to be depressed or happy. Bipolar disorder moods take a life of their own. The victim of the disease cycles at different rates from depression to manic episodes. The depression episode makes the person lose self-esteem, cannot concentrate, it hinders the ability to make good decisions. The depression episode varies in severity from person to person. The depression state of mind causes 70% of the suicides of patients with bipolar disease. At the other side of the spectrum, the patient exhibits what is called the manic state of the disease. This state of mind manifests itself by making the sufferer feel uncomfortable, uncontrollably happy. If the patient has a mild manic episode, then the episode is called hypomania. This state is sometimes cherished by the patients. It gives them a relief from the depression episodes. They feel a high accompanied with a burst of inventive thinking, burst of energy, a lot of ambition. You might think that is a great state of mind. It is a good feeling, but hypomania can have a negative effect if it leads to excessive spending or promiscuity. Unfortunately, many episodes tend to crescendo to feelings of grandiosity. Individuals start imagining they have a special talents and I could achieve unrealistic fame and fortune. The nimble thinking accelerates into erasing jumbled thoughts. The patients might lose touch with reality, suffering delusions, hallucinations. The patients start feeling tense and angry as the mania episode takes hold of them. As far as treatment to this disease, there is no known cure to bipolar disease. Doctors have had a hard time trying to treat bipolar disorder. They are shooting at a moving target. A combination of medicines work in one mood area, and then it doesn't work in the other mood spectrum of the disease. All episodes are different from intensity, making bipolar disorder harder to treat. One medication that have been used for years is lithium. Just like the name sounds, it is a powerful drug that is hard for doctors to gauge a dose that the bipolar episodes are controlled. and the devastating side effects and the drug side effects are not devastating to the patient. It is common for a doctor to prescribe what is called mood stabilizers. The names of some of these drugs are Devaquine, Devacote, and Tegretol. In some cases, antidepressants are administered, but the doctor has to be careful because the antidepressants can act as a trigger, causing rapid cycling from depression to manic episodes. Contributing factors. If you have not realized by now, bipolar is a serious disease that is creating havoc on 3 to 5% of the American population. It is natural to be thinking, can I fall victim to this disease? Well, I have good news to those with good genes. There is only one sure contributing factor: genetics. If you have relatives that been diagnosed or behave similar to what we have discussed so far, you could be affected. Also, a lot of the times, what we think is normal anxiety, depression, overeating, oversleeping can be early symptoms of the bipolar disorder. In conclusion, I would like to leave you with these final thoughts. Not all is lost if you are genetically disposed to this disease. It is believed that very famous people might have suffered from bipolar. Famed individuals like Vincent van Gogh, Isaac Newton, Virginia Woolf. The key for those that are genetically disposed, or even those that are not, should take this information with you. Patients live with bipolar disease between 10 to 15 years before realizing and they have a serious problem. I believe that the more informed the people are, the better the chance to shorten the time of suffering before help is sought, and the better chance a needless suicide takes place to a depressive mood caused by bipolar disease.